Hello, this is Dr. Lewerenz at Longevity Health Institute. Happy, not yet, but quite spring, early spring. Beautiful day, sun's out, April 1st. I'm not going to pull an April Fool's joke on you. But listen, what does everybody care about in spring or almost spring is weight and weight loss. So let's talk about some things that actually can really help you and really impact your quality of life, your energy, but most importantly, your waistline, which everybody cares about, right? Especially going into summertime. A couple of things came up today that were related to this, and that's why I thought I'd talk about it. But let's talk about one thing that's very common out there now, and that's genetic testing. Here at Longevity Health Institute, we do genetic testing very often, almost daily. And we kind of do it a personalized approach, more specifically based on patients' needs and that. But the common test out there now is 23andMe, very affordable. Patients are bringing this up to us, bringing us the results. They're given information now. They're a lot more reader-friendly, layperson friendly, and because of that, they're getting some good information. The one thing I want to stress to you, though, and something we're going to talk about your weight and about something very common, diabetes, is that on 23andMe, there's statistical numbers related to genetics. If you have genetic risks, and they point these out, wonderful, because now we have evidence of something that may be, if you will, a loose link. Genetics are not the end-all be-all. They are not your terminal end sentence of whatever condition, cardiovascular, weight, cancer, whatever it is, okay? Genetics are statistical significance on variations that can cause huge metabolic and health and functional influences, so they're very key. But 23andMe has something new, and they're very advanced in doing some new stuff. I think it's wonderful stuff that are showing like your statistical risk for obesity, your statistical risk for diabetes, type 2 diabetes, which are very common in the over 30% of people have type 2 diabetes in the country, and a third of those people in the country don't even know they have it. And you've heard me say this already, it's very linked to fatty liver. Fatty liver is very linked to diabetes. Obviously, it's a lot how we eat and our environment and our world, how it's evolved and what's normal to eat. But the key thing is this, is that it is not a death sentence. So these genetics put you at risk. Do not freak out. Just bring these up to your doctor, bring them up to us here at Longevity Health Institute. We do personalized medicine, functional personalized medicine, the best medicine there is. And that's not just here egotistically speaking, that's what you should be getting at home and every day. Everybody should be looked at in a personalized way. So when you look at genetics, what do they mean? Well, they're statistics. They say, well, your risk might be this, might be that, 20%, 10%, 7%, etc. Your epigenetics influence everything, including type 2 diabetes and including your weight, okay? Meaning, what are your epigenetics? They are stress effects, mind-body, autonomic effects, psychological stressors, okay? They are your gut, your biome, your microbiome of your gut flora. There's studies that show this. An imbalanced microbiome, a bad gut flora, is not just bad for your immune system, it affects your metabolism, it affects type 2 diabetes, your rates of insulin sensitivity and sugar response. It is your liver and how you detoxify. Your liver is super key as a filter. It's meant to get rid of toxins. We're actually meant to handle toxins and have this, what we call hormetic effect, hormesis, that actually causes our body to create an immune response due to toxins and stress. Believe it or not, it's a good thing. But your liver and how well it works causes an influence on your epigenetics. Hormones, huge influence on your epigenetics. In fact, you can really change genetics and turn on and turn off genes based on hormonal effects. So just remember, your diet, stress, how your liver works, and hormones are a huge part of type 2 diabetes and a huge part of obesity. And 23andMe and these genetic tests that are out now and that we even do here do give us a window. They I call it crack the window open so we can look out and veer into somebody's potential future. But I want you to understand is that it's a small risk, and these things can be augmented by quality of life changes, dietary changes, good knowledge, balancing these epigenetic factors, okay, and good guidance. and good purpose. Okay, purposeful living is, I think, super, super key, and most of the people would agree. Here, what do we always work on with diet? And obviously diet very linked to type 2 diabetes. We always work on 3 key components: hormonal balance. Everything is about balance, right? Your liver, how it functions metabolically. Is it detoxifying appropriately? Do you have a diet that supports that? Do you have potentially needed short-term supplements that support detox? Okay. And then what you're putting in your mouth, or caloric burn. But it's not as simple as calories in and calories out. That is true to some degree, but not all calories are equal. Meaning a 400 calories of broccoli does not have the same weight effect, and this has been done in studies, than a 400 calorie count of bread. Okay, they're both 400 calories. They're both part of the energy and heat burn of caloric counting, okay, that your body does, but they do not have the same effect on the waistline. And why is that? Well, something like broccoli or like a cruciferous vegetable has positive effects on your liver and detoxification, has positive effects on enzymes that help your digestion and your gut flora, have positive effects in eliminating negative hormonal things that cause hormonal imbalances, okay? So yes, they're equal in the sense of calories, but not equal in the sense of the health benefits, okay? That's why eating whole food and vegetables and colorful things on the earth that you've been given are so important. Now, that being said, the bread, the 400 calories of bread, well, why is it bad? It's not just that it's bread and you hear that gluten's bad. Gluten is bad in this country, okay? It causes definitely damage to the epithelium and the mucosal lining of the gut, and increases your risks of leaky gut and immune issues and etc., inflammation, blah, blah, blah. But the fact is that when you have a carb, a starch, a macro, like a carbohydrate in a big dose like that, you're actually causing a hormonal influence negatively. You're getting insulin spikes, you're getting then fats with the insulin and sugar shunted to your fat storage. You get fatty acid actually deposition versus release for energy, okay? And what are you doing? Essentially, short of the story, you're storing fat. It's why you get in the afternoon after a sandwich or after a piece of pita or bread or pizza or starch or something like this at lunchtime or midday, you're getting these big insulin and sugar swings, thus that make you have an afternoon crash and putting stuff on your waistline. So remember that calories don't always equal. So you need a good nutritionist, you need a good dietary instruction. Our basis here is guiding you with a whole plant-based diet with a good amount of protein and macros, but not excessively. We call it Paleo, we call it Mediterranean Paleo, these versions, obviously gluten and dairy free, but you should eat of the rainbow, eat of colors. Your plate should always be full of colors. Things should be fresh, often not cooked vegetables, okay, because of the enzymes and actually toxins, believe it or not, hormetic toxins that are in vegetables that actually have positive effects for us. That's right, you heard me say that right. Toxins can be positive for us, okay? So, but these are very important to have these whole products in your diet and not just calorie counting or 1,500 calories in, if I burn 1,500 calories, I'm equal, okay? Now, also remember a few things that are just tips. Intermittent fasting's got studies and proof and evidence that you do lose weight, you will burn calories, you change your metabolic rate. You've heard me talk about this. You've also heard me talk about that HIIT training, high intensity interval training, because of the stress effects on the body cause a hormetic effect or hormesis, and this actually causes a positive influence on you change your metabolism. So summary here is this: be balanced, do a personalized approach to weight loss that is diet, macro calorie counting, whole food eating, hormonal balance, okay, checking your hormones, make sure you're balanced. Obviously you should be doing this easily, commonly in your 40s and 50s and beyond, but sometimes even your 20s and 30s are potentially, you need to look at things like insulin and thyroid and progesterone and testosterone, and how your liver detoxifies, okay? And to summarize, this is important even if you have genetic or not genetic risks, because these are the epigenetics that turn on and turn off the genes. So it is a good test to do these 23andMe tests, these genetic tests, to give you a look into the window of your health, but also you are in control of that by the way you live and how your approach to your life and to your purpose in health and wellness living. So I hope this finds you well. I hope that enlightened you and educated you. I hope this always stimulates you a bit to be healthy and live in the right way, to live long and strong and healthy for you and your loved ones. This is Dr. Lewerenz, Longevity Health Institute, Rochester Hills, Michigan, Madison Heights, Michigan, and soon to be Bloomfield, Michigan. Me and my practitioners are always bringing you the best in functional personalized medicine. Be well.